Okay, so today we want to talk about something else, which is called wound healing, as you can see in that presentation. Now, you want to first pause and think about, uh, we have just been talking about inflammation, and we said that there is some form of trauma, or there is some cause of injury, or some form of injury to what we refer to as vascular connective tissue. And so we said that the tissue has to be vascular, because then in that way it will be able to respond to inflammation because of the changes that are actually observed as far as inflammation is concerned. Now, with wound healing, we want to find out exactly what happens as far as, when you get an injury, what exactly happens for you to heal. And that is what we refer to as wound healing. So by the end of this lecture, you will be able to know how, like, for example, what is wound healing, how does this healing come about, and how it happens. But also, you should be able to know the factors that influence a wound to heal. Yeah. So that is what we are going to go through in a minute as we move on. Now, we are saying that as far as the introduction is concerned, we are saying that destruction of tissue is basically followed by healing. Yeah, that usually begins with acute inflammation, as we have mentioned, but then it may not, however, be complete for as long as 2 years. In other words, you have injury, and then you have acute inflammation, but the actual or the final healing will not occur up to about 2 years. Yeah, for some cases. However, others it might be as simple as maybe weeks or even months. So it's basically the process of wound healing varies. Now, we are saying that the most favorable outcome of healing is basically what we refer to as tissue regeneration. In other words, we mean that once you have injury, or once you are injured, then the most favorable outcome, in other words, what we want the outcome to be, is that you need regeneration. In other words, you need the tissue to regain a status that probably it had before. Yeah, what we refer to as regeneration. In other words, we need it to return to a state which is almost normal to what it was before. Yeah. However, this is not usually possible. However, when we have healing, we have, it basically goes almost towards normal, but complete total normality is never, is never possible. Now, if the damage is minor, and then you don't have any other complications, yeah, and the destroyed tissue is capable of regeneration, then it is possible to return, to approximate normal function. And this is what we refer to as, resolution. And so we are saying that if there is minimal damage, and less tissue has been destroyed, and there are no complications as far as the wound is concerned, then there is, some kind of return to normal, but it is not 100% return to normal. Now, this is what we call restoration or resolution. Now, however, if there is extensive damage, just imagine a flap, your hand has been damaged, and maybe a flap taken off. Yeah. So there is extensive damage, there is too much tissue destruction. And so if this is present, that basically means that the tissue will not be capable of regenerating. Yeah, because there is too much damage and too much destruction of tissue. What actually happens here is, if instead of regeneration, instead of resolution, we have what we refer to as repair. Yeah. So you have it basically modulates or there is remodulation to refer to, or to have a repair, and not regeneration or resolution. In other words, we are saying in simple terms is that if there is no extensive damage and if there are no complications, then the tissue will regenerate, or we shall have what we call resolution. However, if there is extensive damage and if there is too much tissue destruction, there is inflammation, there is extensive inflammation as a result of infection and abscess formation, and if there is granulomatous tissue being formed, then we cannot have resolution, but instead we refer to it as repair. In other words, the wound healing occurs by repair. Now, so in other words, we are saying repair is replacement of destroyed tissue with scar tissue. In other words, the tissue that is replaced is not the same as what was there before, and so what is replaced is what we refer to as scar tissue. So healing by connective tissue repair, in other words, once there is healing by scar tissue or scar formation, basically we have 3 phases that are involved, and we have angiogenesis and ingrowth of granulation tissue. Angiogenesis will basically mean growth of blood cells or blood vessels to that area. And then the second phase, we have what we call immigration of fibroblasts. In other words, the fibroblasts, remember fibroblasts are responsible for formation of fibrin. And so you have fibroblasts immigrating towards that area. And so fibrin will be, will kind of like be formed to close up, fibrin and collagen will be formed to close up that place that, where tissue was destroyed. And then further, you have the maturation and what we call reorganization of fibrous tissue, or what we refer to as remodeling. So those are the 3 phases that occur. I'm going to provide you with a detail of these in a Word document so that you can know, or you should be able to see what exactly happens as far as which phase is concerned. Now, there are factors that basically major factors in wound healing, and these are referred to as, like for example, we have like for agenesis, we have what we refer to as just a minute. For agenesis, we have growth factors like epidermal growth factor, what we call EGF, and then we have transforming growth factor, which is TGF, and then we have things like platelet-derived growth factor. These are where you see plus, 0, then plus, plus. It basically means in those growth factors are very key in those different processes. Like for example, with the angiogenesis, as we said, angiogenesis is basically growth of blood vessels in that area. So with angiogenesis, then we have things like epidermal growth factor. It is very key. We have things like the transforming growth factor is also very key. Now these growth factors are basically released as a result of of inflammation, and they are also released to help facilitate wound healing. Yeah. So and also interleukins, and then tumor interleukin 1, yeah, is also a very good growth factor that is identified as far as angiogenesis is concerned. And then the TNF factor is also a very good growth factor in this. So basically, for proliferation of fibroblasts, we are seeing that, again, that is essential. This one is essential. The platelet-derived you know, growth factor is also very essential. Then we are seeing that we are also seeing that the basic or what we call the fibroblast growth factor is also very, very important. Yeah, the fibroblast growth factor here is also very important as far as you know, the process of proliferation is concerned. So those are the major growth factors. And of course, where do these ones come from? They are basically one, released from the site of injury, but they are also manufactured by the liver. Yeah, exactly. Now, the other one that we want to talk about is cutaneous wound healing. In other words, the wound healing that occurs when you know, when the skin is damaged. Yeah, and that is what we refer to as cutaneous wound healing. And so this is a process that involves both epithelial cells and regeneration and formation of connective tissue, scar formation, and thus is illustrative of what we call the general principles that apply to general wound healing. Now, I want to share with you this PDF, which I'll share with you later on. But it documents and highlights the different phases of wound healing as far as cutaneous tissue is concerned. So if you don't mind, let me share it with you here, and so that you can see it. So new share. Let me share with you this thing here, so that you can. So if you can see this, this is a document that is basically highlighting how the different phases of wound healing. And if you can see, there's what we call the inflammatory phase of wound healing, which basically, we have already talked about inflammation. And so the phases of inflammation occur. And this is the first phase of cutaneous wound healing, where you have, you know, you have injury, you have migration of, you have what we call the vesicular, and then the cellular changes, bringing about you know, what we refer to as the inflammatory phase. Now, after the inflammatory phase, you have what we call the proliferative phase. And then what we mean by this is that we have cells going to the place of injury. Yeah. So we mean things like the primary process during this phase focus on the building up of new tissue to fill up the wound space. And here we talk about the fibroblasts. So the fibroblasts basically, they go to this area to fill up, you know, the space that is there. And as you can see in this diagram very clearly, let me just do something like this so that you can appreciate it in this diagram. If you can see, you have, this is the space, and then you have the fibroblasts. Yeah, the fibroblasts are filling up, you know, filling up the fibroblasts. These ones here, they are basically filling up the space, and will eventually manufacture, you know, things like collagen, proteoglycans, and you know, glycoproteins, basically, that are needed in the process of wound healing. So that is the proliferative phase. And then finally, you have what we call wound contraction and remodeling. Yeah, this is another phase that that occurs after the proliferative phase, and this begins approximately 3 weeks after injury, with the development of, you know, scar, a fibrous scar, and it can go up to you know, up to 6 months. And basically, what happens here is that there is increase in the collagen formation, which makes the wound you know, contract. In other words, be able to regain shape and remodel, for that matter. So that is basically those are the phases of you know, of wound healing. So we are saying first is inflammatory phase, then we have the proliferative phase, and then what we call the wound contraction and remodeling. Now that is typically what occurs for cutaneous wound healing. Those three phases are typically what occur for cutaneous wound healing. So taking you back to the earlier presentation, we are saying that with cutaneous wound healing, we've looked at the phases, the inflammatory phase, the proliferative phase, and then the wound contraction and remodeling. Yeah, so that is basically what happens. Now, there is also what we call healing by intention. Yeah, so there's what we call healing by primary intention and healing by secondary intention. Now, depending on the extent of tissue loss, the wound closure and healing occur by either primary or secondary intention. So with primary intention, we mean that, you know, the wound heals and opposes very well. Yeah, the wound heals and opposes very well because one, there is minimal tissue loss, but also, you know, minimal complications and limited infection. So with primary intention, healing by primary intention, we look at wounds that maybe have been, maybe someone has been operated upon and cut very well along, you know, along a surgical incision. So there, a wound can basically heal by primary intention. On the other hand, larger wounds, like for example, burns, or maybe there's too much tissue loss, or maybe the wound is contaminated, and as a result, it ends up being infected. So that basically means that the wound will not heal by primary intention. Instead, it will heal by secondary intention. So healing by secondary intention is basically slower than primary and results in formation of large amounts of scar tissue. And a wound that might otherwise have healed by primary intention may become infected and therefore healed by secondary intention. So in other words, we are saying that what are the prerequisites for healing by primary intention? The wound must be clean. It should not be, you know, infected, and there should also be minimal tissue loss. Yeah, so that is how a wound can heal by primary intention. On the other hand, if a wound is infected, if there is too much tissue loss, or if maybe the wound has a lot of debris in it, then it is liable not to heal by primary intention, but instead heal by secondary intention. So this is what we are saying. You can see the wound that is minimal tissue loss, and the surfaces can easily be, you know, opposed to each other and sutured. Yeah. However, with secondary intention, as you can see here, there is a lot of you know, tissue loss that you know, it will not be able to heal by primary intention, and so it will heal, or it will have scar, you know, scar tissue being formed at that particular place. All right. So the other thing are basically complications of wound healing. What might come as a result of wound healing? One of them is, you know, infection as a result of entry of bacteria. Then pigmentation of wounds that at times might have rust color, you know, due to staining with hemosiderin. In other words, too much iron deposition in the wound can also, you know, delay its healing, and that is what we call hemosiderin deposition. So wound dehiscence can also occur. So in other words, it gaps or it gives way. Yeah, and so that can also be a complication, especially after laparotomy for people who are fat and people who are obese. Wound dehiscence can easily occur. The other one is, you know, formation of, you know, a scar tissue, a hypertrophic or hypertrophied scar. So in other words, these are the people, I don't know whether you've seen people those, especially those people who make what do you call it? Who put pins in their ears. Someone has a scar, a very big scar that formed as a result of of putting a hole in the ear. So a hypertrophic scar, also referred to as a keloid, can also form and therefore be a complication of wound healing. Then the other one is excessive contraction, which can lead to formation of contractures. Like, for example, someone healed, but the place contracted, and therefore the person is unable to use that part effectively because of the contractures that have been formed. The other one is in the process of wound healing, you can have neoplasia, or maybe you can have carcinoma developing in the process of wound healing. This is very common with skin cancer, and that can also be one of the complications of wound healing. Now, the other thing is, what we should talk about are the factors that basically influence wound healing. What are these? Things like infection, blood supply to the area, foreign bodies, if you don't immobilize the place, yeah, exposure to ionizing radiation, exposure to UV light. All these can basically influence the healing process. And other things like age, nutrition, systemic infection, some drugs like steroids can also, undermine wound healing. And also uncontrollable diabetes, and then hematological abnormalities. All these can basically try to influence or maybe score down the process of wound healing. So basically, that has been that as far as wound healing is concerned. Now, I want to give you an assignment to read about, how healing occurs in special tissues. Like, for example, how does healing occur in bone? How does healing occur in nervous tissue? I want you to read about that. But generally, the phases of wound healing are general. They basically apply to all tissue, apart from a few specifics. And inflammation, proliferation, and then remodeling and wound contraction. Those are the general, the general phases of wound healing that you should not be able to miss out. So basically, that is it about this. Lecture concerning wound healing, and so you should be able to know what wound healing is, how does wound healing occur, what factors influencing wound healing, what are the processes or the phases of wound healing, and then also what actually, how do different tissues heal as far as wound healing is concerned. So please read more about it. In case there's something that you do not understand, please make sure to inquire. Thank you.